Hello, I'm Dr. Ryan Kazemi. One of the most common reasons for removal of dental implants is advanced bone loss from an inflammatory condition which is known as peri-implantitis. Now, such conditions usually start as a mild inflammation known as peri-implant mucositis, and if they're undetected or untreated, can easily advance to a peri-implantitis situation. In moderate to advanced cases, the only option may be the removal of the implant, the restoration of the bony defect, and then followed by a dental implant replacement at a later time. So in this video, I'm going to show you a conservative and a non-invasive technique for removal of a failing dental implant without any incisions in the gum tissue or removal of any bone around the implant. This patient had a dental implant with moderate amount of bone loss from peri-implantitis and an ongoing pain for some time. But the implant remained quite integrated and stable in the bone. The treatment plan was to remove the implant, clean the site and the infection, and then restore the bony defect for replacement with a new implant at a later time. Let me show you how we can remove this implant without a single incision or any bone removal around the implant. Once the crown is taken off, the screw that retains the abutment part is loosened, and then both are removed. This allows the exposure of top of the implant. For atraumatic removal of this implant, we're going to use a reverse torque technique using a special device. First, a guide screw is placed on the implant and then tightened in position. Then, an implant removal device is adapted and then rotated counterclockwise until its serrated edges engages the top of the implant. Next, I'll use a wrench in reverse, providing the necessary torque to break the bond between the implant and the bone. With sufficient and carefully applied load, the implant is gently and slowly reversed and then backed out. Next, we'll clean out all the inflammatory tissues from the implant site and then irrigate it with saline. Now in this case, we have a well-contained bony defect with intact walls on all its sides. So we will simply place a bone-stimulating graft material that helps to maintain the blood clot and promote the healing of the site. We'll keep the material stabilized with a couple of dissolvable sutures. Patient will have virtually no pain and absolutely no swelling. And the socket is allowed to heal for about 3 to 4 months and then reassessed for dental implant replacement therapy. This is a remarkable technique that can be used on virtually any type of dental implant and works whether the implant is completely integrated or not, and whether it was placed recently or years ago. Removal of ailing or failing dental implants is a well-accepted and a gentle procedure when it's performed with this technique. It preserves the surrounding bone and allows for a rapid recovery with no or little discomfort.